Yeah, first we're going to have Dan Ostlie.
Thanks for the invite. I've got a bit of a cold, so I apologize if my voice doesn't sound normal or if I go into a coughing fit. I think I probably got the easiest talk, actually, when I began writing this talk. I do have an ownership interest in Just Right, but believe me, we have nothing to do with achondroplasia. So just a little bit of the laparoscopic background that everybody's already seen, I think, from the slides that have been put up already. There certainly has been long-term validity that's been shown how effective the laparoscopic Heller myotomy is. It's got equal results to open without a doubt. I don't think anybody in this room, if I asked you to raise your hand and said, would you rather do an open Heller or a lap Heller, I would hope nobody would raise your hand with regard to that. It's also been shown to be as cost-effective now. Early on with any laparoscopic technique, there was some increased costs, probably related more to time than it would be to the actual instrumentation themselves. But now, as advanced laparoscopies come along, and I would not say that a Heller myotomy is considered a significantly advanced laparoscopic procedure unless you don't live your life in the foregut world, which no pediatric surgeons or any foregut adult surgeons do. And clearly there's been shown to be patient benefit with short length of stay, yada, yada, yada. But the robot, we're not really sure about all that, right? I mean, let's just go back and talk a little bit about what the robot has been brought to us for, okay? And these are kind of just the things that I thought we should point out. It was developed, right, to assist with difficult operations. And so you got the low anterior resection on the left, the prostatectomy on the right. Does anybody in here really think a Heller myotomy is that difficult of an operation? Or better yet, is anybody in here using the robot for fundoplication? Because we're not really doing much more than that, okay? So one person, congratulations.
Actually, three.
Two. And for those patients that have, those surgeons that maybe have less experience and need the technical advantages that the robot adds for that. What about cost or return on investment? This is some information that was just published in 2014. So the upfront cost for a robot is between $1.5 and $2 million. The annual upkeep is between $100 and $150,000 a year. And the return on investment is between 150 and 300 cases per year for 6 years before you break even. So let's make sure we're not using the robot for the Heller because we need to justify this reason why we have the robot from a cost standpoint. Each robotic procedure costs about $1,500 more than an equivalent laparoscopic procedure. So why is there any benefit, or why should we be thinking about using the robot for the Heller myotomy? A couple of studies that have been out there, and you gotta like retrospective studies, especially from single institution centers, and I am as guilty as anybody in this room about publishing your experience doing something and putting it in print for the sake of whatever that is. This is a 75-patient study that was done between 1995 and 2006, reported last year. They showed no difference in symptom control between the Heller, or lap Heller, and the robotic Heller. But in this person's hands, or this institution's hands, there was a lower perforation rate and a shorter length of stay. The problem is a single institution, and there was a significant learning curve because the earlier perforations occurred earlier in their experience, which happened before they started using the robot. So the robot was the natural progression. So I'm not sure that that's really fair to make a conclusion that that conclusively the robot itself leads to fewer perforations. Here's a larger database study that was performed over a later period of time, 2007 to 2011. There were 2,000 lap Hellers and 149 robotic Hellers, and you can see that they're pretty much across the board equivalent numbers. There are some things that favor the robotic, but nothing reached statistical significance until you get down here to the cost, and the Hellers costing about $2,000 more with no clinically relevant short length of stay difference or morbidity changes between the two of them. And then this is the largest study that I could find. Now this is not just Hellers, okay? This is looking at the robot in general, but I pulled out the Heller data. There were 96,000 procedures comparing robotic to laparoscopic general surgery operations. This is published in Surgical Endoscopy in 2014. There were no difference across the board between robotic and laparoscopic operations in complications or mortality. The robotic Heller did have a shorter length of stay, but whether or not that's clinically relevant at a half a day, I don't know if I can commit to that. But the robotic Heller costs significantly more, 21% more than the laparoscopic Heller did. What about patient benefit? Right, I mean, I think POEM is awesome. I'd sit up here and a little bit, taken aback by the fact that we as pediatric surgeons haven't really started to embrace this, because I think there are some significant patient benefits that exist with POEM. But I can't see any patient benefits right now that exist for robotic Heller myotomy, because you're doing the exact same operation. You're just using a big piece of equipment to do it. And there's been no reported benefits of improved symptom control or long-term symptom control associated with the robotic Heller. There's absolutely no cosmetic benefit associated with it. And there's no evidence that there's quality of life or faster return to work associated with it. So in conclusion, the Lap Heller has been shown to be safe, less expensive, and efficacious with regard to symptom control when compared to either the open or the robotic. The robotic may be associated with a clinically irrelevant shorter length of stay. And in inexperienced hands, maybe there'll be a decreased rate in perforation rates. But given the current published data, Lap Heller should be the approach for laparoscopic treatment of achalasia.
All right.